Hello, I'm Beth Wagner, physical therapist. In this video, I'm going to show you two excellent flossing exercises for obturator nerve entrapment. The obturator nerve originates from the second, third, and fourth lumbar spine nerve roots. It passes through the pelvis into the inner thigh. Compression can occur anywhere along the path of the nerve, and common causes include injury, trauma, inflammation, fascial tightness or tightness of the connective tissues, and pregnancy. Symptoms include pain, decreased sensation, and numbness and tingling in the inner thigh, and weakness in hip adduction, which is the ability to move the legs together or to bring the hip back toward the center. Just as a reminder, please click the thumbs up if you're enjoying this video so far and consider subscribing to my channel. All right, let's jump into the obturator nerve flossing exercises. The first flossing exercise will be done seated. Start by sitting on a supportive chair with your feet flat on the ground. Sit with upright posture, getting as tall as you can, and scoot a little closer to the edge so that your legs have room to move. Keep your feet flat on the ground with your feet and your knees about hip distance apart. And I'll demonstrate this on the right side first. Sweep your right leg out to the side, just as far as it feels comfortable for you to go. Pause, and then bring your leg back to the center. Place your foot back down on the floor. Again, sweep your right leg out to the side with slow, smooth motion. Put your foot down on the floor, pause, and then sweep the leg back into the center and rest your foot on the floor. Now let's add the head movement. Start with bending your head down to look toward the floor, and then as you sweep your right leg out to the side, lift your head up and look toward the ceiling. Pause, and then lower your head as you bring your right leg back toward the center until you're looking down. Again, as you sweep your right leg out, look up toward the ceiling, pause, and sweep your right leg in as you bring your head down and look down toward the floor. Sweep your leg out as you look up toward the ceiling, pause, and then sweep your leg back in as you look down. Continue with slow, smooth motion. The sweep out to the side and the head goes up. The sweep back to the center as the head goes down. And rest. Shoot for 10 repetitions at a slow and smooth pace. Start with what you can do and gradually build up as you practice these flossing exercises day by day. Now I'll demonstrate on the left side. Start with your head bent down, and I'll sweep my left leg out to the side as I tilt my head up and look to the ceiling. Pause, and then bring the leg back in as I look down. Sweep the leg out and look up. Sweep the leg in and look down. Continue sweeping the leg out to the side and looking up, and coming back to the center and looking down. Only move your leg as far as you feel comfortable, and only look down and look up as far as your neck feels comfortable moving. Start these exercises gently. It's better to only move a little bit at a time than push it too hard. As you practice these exercises day by day, more than likely your range of motion will improve and you'll start to feel more flexible, with less discomfort as you move through the exercises. Stand with tall, upright posture with your feet about hips distance apart. Lift your chest, relax your shoulders down and back. Do a little bit of a chin tuck. Can also be helpful here to engage your abdominals, pulling your belly button in toward your spine and engage your gluteal muscles in your buttocks. Now standing next to a countertop or sturdy chair for support, shift your weight over to the left side and now lift your right leg up to the side. Keep your ankle bent, keep your toe flexed up instead of pointed. Pause and then come back to the center. Shift your weight to the left, lift the right leg up, pause, and come back to the center. Lift your leg up just as far as you feel comfortable going. and back down. To start off, you might only be able to lift it a little bit, and that's just fine. Listen to your body. Pay attention to any sensations, numbness, tingling, pins and needles that you might develop through the inner thigh with this exercise. Shoot for 10 repetitions at a slow, smooth pace. Start with what you can do and gradually build up. You might also try matching your breathing with the movement. Inhale through the nose to prepare, and then exhale as you lift your leg up to the side and lower. Inhale, and then exhale, lift and lower. If that feels comfortable, fantastic. You could also try breathing pattern of exhaling as you lift your leg and inhaling as you lower. So start again by inhaling to prepare, and then exhale, lift, inhale, lower, exhale, lift, inhale, lower. Make sure that your motion is steady and controlled on the way up and on the way down. Now for the flossing exercise on the left side, stand with the countertop next to you on the right. And shift your weight over to the right leg and lift the left leg up, pause, and lower. Inhale to prepare. Exhale, lift up and lower. Inhale. Exhale, lift and lower. Now I'll try exhaling and inhaling. And exhale, lift, pause. Inhale, lower, pause. Exhale, lift, pause. Inhale, lower, pause. Exhale, lift, pause. Inhale, lower, pause. Now you will likely feel some muscle activation in the outside of the hip on the leg that you're standing on. That's normal. You're using the gluteus medius, the lateral hip muscle here, for stability while you're standing on one leg. So you're getting an added benefit of some strengthening on the outer thigh. That's totally normal. If you're feeling any muscle activation, fatigue, or any muscle soreness, that will likely go away after performing these exercises a few times. If you need to start with fewer repetitions or shake your legs out in between repetitions, that's just fine. I recommend performing these exercises on both sides, even if you're only experiencing symptoms on one side. It's helpful for symmetry and for balance throughout the connective tissue, and the muscles, and the tendons, as well as the pelvis and the lumbar spine. For best results, do these exercises 1 to 3 times a day. You might begin to notice improvement as soon as the first session. However, typically, lasting improvement requires daily, consistent performance for about 6 to 8 weeks. I hope you've enjoyed these flossing exercises for obturator nerve entrapment. And ultimately, I hope these movements help you get back to doing the things you love to do every single day. If you like this video, please click the thumbs up and subscribe to my channel. You might also benefit from flossing exercises for the femoral nerve and other nerves in the lumbosacral region. Click the links in the description below to check out those videos. You might also check out my other videos covering low back and hip issues. See the links in the description below. Please leave any questions and comments down below, and I'll get back to you as soon as I'm able. Here's to your healing, health, and happiness. Have a fantastic day.